www.schefterlaw.com. The Stress-Free IEP video podcast is also posted on YouTube and LinkedIn, and you can listen to episodes through Apple Podcasts, Spotify, Google Podcasts, Stitcher, and more. Now, here's the host of Stress-Free IEP, Frances Schefter.
Hello, everyone, and welcome to our show. Today's guest is Jennifer Schutz, did I say that right? I think so. With Willow Tree Parenting out in Seattle, Washington. So Jen, tell us a little bit about yourself and what Willow Tree Parenting is all about.
Yeah, hi. So glad to be here. So thank you. So I am a mother of 3 neurodiverse kids. So we have all the diagnoses in our house. I am a parent coach, a certified parent coach. I work with mothers specifically who have kids with special needs, autism, ADHD, OCD, anxiety. Excuse me. I'm also a mental health nurse practitioner, so I work with the kids in my practice. I am an IEP parent partner, which just means that I've been trained through our county here in Seattle, Washington, to go in and be an advocate for parents who need assistance in IEP processes. And then I do trauma. I'm trauma certified because I also work with foster and adoptive parents.
Wow. So that's something we have connection. I do a lot of work with DC Superior Court foster system as an education attorney. And then I'm also, my family, we foster kids out in Maryland as well. Because that's where,
My part.
Yeah, I love when I talk to people because you never know who's out there that that community is so needed, and I love that your county actually certifies coaches in IEP process. Is that so? Then do you find do parents pay you or do you work through the county? How does that work?
So it's actually it's a national organization called ARC, A-R-C. There's the ARC. So we have ARC of Washington State, and then we have ARCs for the different counties. And so the ARC of King County, that organization does training for parents to become a parent. It's called a parent-to-parent advocate. And so we're trained through the IEP process and all the different nuances. I mean, it's so technical, and that when parents get thrown in, and you're facing the school system, it could be, very scary and overwhelming. And so if someone is just kind of stuck or needs some support, we can go in. A lot of it now is virtual, unfortunately, but you go in and you're there with the parent to help kind of just be an advocate and just be another set of eyes and ears for a parent, because you're just a deer in headlights.
Right. What I tell my clients is that you guys can be the parent at the meeting. Don't worry about it. I will catch everything. I will have it all listening. Just be the parent. That's why I'm there to support you. Say whatever you want. Give your input. I always tell my clients, there's nothing you can say in an IEP meeting that I can't turn around to what my client is trying to say is, and put it in teacher terms.
Right. Thank God for what you do. It is so, so needed, and that having that support and knowledge, because there's just so many little like I said, nuances and terms that as a parent is just so overwhelming.
Right. And that's why I say often, educate yourself. That's the first thing as a parent. I mean, both my kids are neurodiverse as well. And just educate yourself. That's part of the reason I have this show of what's out there, who can you get there? And, start with a parent coach. I always say that as well. If you're already in a disagreement, then yes, you probably need to hit an attorney instead of an advocate or a parent coach or something. But if you're just, I don't understand, I don't know what to do, I highly recommend parent coaches and advocates all of the time. Because it's, yes, attorneys are expensive, but then when you look at it, it's, this is your kid's future. What's it worth?
Right.
So,
And I say, start as early as you can, the younger that you can, to really fight to get that foundation of learning for your kids and the right goals and the right accommodations, because it just keeps building and building, and the harder it is as time goes on.
That is so true. Yeah. I mean, I always say that the earlier the better. And, I don't want to say overload them, 'cause it's not really overload them, but provide as many supports and backgrounds as you can to prevent. Because a lot of times, I don't know if you see it also, but like with our autistic kids and even sometimes our ADHD kids, they mask so much and then they fall behind, but they're so smart, they manage to not show that they're falling behind until like third and fourth grade, where it starts really getting more difficult.
Absolutely. The masking is a really, really key piece that parents, and even, parents and teachers are like, oh, they're fine. They don't need help. They're doing, especially I see a lot of girls, teenage girls in my practice as a healthcare provider who come in and they're like super anxious and depressed because they have been undiagnosed and they have been masking all this time because they're people pleasing or they don't want to get in trouble and they're keeping it together, and it has nothing to do with, and they're embarrassed. It has nothing to do with intelligence. It has to do with they just think differently. And so the masking is really a really hard one to pull that off. And I've been trying to teach my kids, you be you, my friend. You are you. You're a unique person. You have your own superpower. And let's live into that and let's focus on your strengths and then have the scaffolding that you need through school. But I don't ever want you to like pretend to be somebody you're not if you don't want to. You can choose to do that in certain situations.
Right, but I've seen, and tell me if you've seen this also, but I've also seen a lot of our kids, they don't even realize they're masking because society is telling them to do this, to be this way, to act that way. And they don't know that it's not difficult for other people and what they're doing. They're just trying to be a good kid. So have you seen that a lot?
Yes, I think it depends on like the environment that is cultivated at home and at school, and then also individually with the child of like, are they just a natural born people pleaser? Are they a natural born introvert? And that's just, they don't want to draw attention to themselves. And so I have organic conversations with my kids all the time, and just to kind of live into their own person and their identity. But kids have a sense of wanting to belong. And so, especially as they get into those tween years,
Yep.
which I'm in the thick of that right now with, I got a 10 and 11 year
Mine's
old.
9, so I'm getting there. I'm like just on that.
I'm like, what's happening? And so I can see that he is now like trying to fit in and trying to like, he's got an IEP. He's, being pulled out every so often, and he's kind of resisting that. So
Right.
I'm still have these continual conversations of like, this is what you need. You need to, like teaching them how to advocate for themselves, but also knowing how they're going to feel good about their own selves as well. Like I don't want to feed into that anxiety, don't want to feed into that sadness, and that self-worth is pretty huge, especially with,
Yeah.
autistic and ADHD kids.
Yeah, that's a conversation I have often with my clients of like, yes, the school system has to supply this. Yes, the school system has to do this, but is it right for your child? Because sometimes I'll say like, look, and like what I'm doing with my own kids, yeah, you could get them pulled out, but then they're missing content, and that's raising the anxiety. Whereas if you do tutoring at home, you're getting the same thing. Yes, it's costing you money, but you're looking at the whole child.
Right. And like
Need.
what that child needs and where they are developmentally, because it changes. Yeah,
Yeah.
absolutely.
Yeah. And so, and I love that I shouldn't say I love, but the fact that you're a parent just probably makes you so much better as a coach. Like the same for me. Like I'm a better attorney because I've been a special ed teacher, I've been a regular ed teacher, and I'm a parent. So I know where you are, right? And so how do you find that helps you, like when you support families in IEP meetings?
Yeah, thank you. I do feel like I have the lived experience. I'm in the thick of it at home. I myself have ADHD. I work at it, work in the mental health field, and I also work with parent coaching. So I am in it, I breathe it, I live it, and I feel called to help other parents because I remember how I was years and years and years ago when with the diagnosis and trying to navigate, and then you have the healthcare system bombarding you with, you should do this, and then the parenting books that not all the parenting books are aimed for our kids. So it's just like this rough road. And so, when I do talk to my clients, it's not like a one size fits all, because
Right.
everybody's so different. One autistic child is different than another autistic child. I mean, all three of my kids have ADHD, and they're all completely different. So everything is kind of tailored for the individual child, the family. And then also that changes over time. My 8-year-old is autistic, and he's a very different person than he was, just a year ago. So
Yeah.
it's
And
always,
it's,
it's always moving.
right. And it also matters what as a parent that you want for your child, which is always a challenge, because we want the best for our kids. We're parents, like, of course, obviously, but what does that look like, and what do you think that looks like? And it's hard when they're younger, because they don't have an idea of what it should look like. Like when they hit high school, okay, this is what I want my life to look like, and we can go that way. But when they're younger, it's like, what do you think is the best thing? Do you think being in a special ed school is where they need to be? Do you think staying in the general education population is where they need to be? What do you think as the parent? Because honestly, it's the parent that knows the most at any IEP meeting, because it's their kid, right?
Yep.
They do.
Absolutely.
They might not know the education and the special ed and the curriculum, but they know their kid, and they know what their kid needs.
Mm-hmm. You are, like, you hit the nail on the head. And like, some parents will go in and they just don't want to rock the boat, or they don't want to, like, make enemy. Like, you're not really fighting. You're not supposed to be fighting, technically. But going in and just listening to your gut and saying, I know what my kid needs. I know what is right. I see it at home, and let me explain that to you and show you what my child needs. And I don't know about you, and when you work with your clients, do you encourage the kids to attend IEP meetings, or is it too far in, like, the process with the legal battle?
When they're older, like high school kids, I always say they come for part of it, not all of it, because it's hard for them to sit through like the present levels and everything. But when it comes to supplementary aids and accommodations, I like the high school kids to be in there, because they can tell us. Because once they hit high school, they're the experts, and they can say, like, yeah, you know what, when you give me this, it helps, but it doesn't help when you do that. So, like, let's get the IEP tailored to what the child thinks they need.
Yeah.
So, but younger, no.
Yeah. Okay.
Yeah, because it's a lot. I mean, maybe middle school, depending on what the parents think with the middle schooler. But again, it's just like for that part of it, of like just asking them, what do you see? What do you need? What do you want? What do you think where you want to be?
Yeah.
But that's so big part of my practice is finding what the parent wants as the ultimate outcome, and then we can reverse engineer it and get to, like, so now this is what we need to do in each grade level as we go older to get to that ultimate goal.
Okay.
So
Yeah, I see in my clinical practice, I see the children. So on the coaching side, I work with parents. In my clinical practice, I work with the children and teens. And it's interesting to have both different sides of what the kids are experiencing and their lived experience, and then the parents' lived experience and how they are struggling, to understand what's going on with their kids, and where they need support. So sometimes it's very fragmented, and other times it's, I come in and I help align both of them. So it's more of a community connected effort for both.
Right, which makes sense. And it's hard because, as parents, we have dreams for our kids and what we want them to do and be, and, and it's like, you know what? It's okay if they don't go to college. It's okay if they choose, like whatever it is, like we need to, I don't know if it's like living vicariously through our kids or what, but like let go of our dreams for our child, and let's develop your child to reach their full potential.
Oh my gosh, Frances, that was beautiful. Yeah, what you say. I, like, all the time I have to, like, check I've had to check my expectations, and that's kind of where we start with parenting. The coaching is that, okay, what is your expectations? And we may have to grieve and,
Yeah.
change and alter what you think your control is on their dreams and their path, because that may be different.
Right. No, that's so true. Yeah, and it is a grieving process because it's, like, yeah, our kid's not going to be a rocket scientist, but that's okay, you know?
Hey, that's okay. And they all have, beautiful superpowers. And it's sometimes like it's rewarding, like when they talk about like, especially kids with ADHD who are hyperactive and all they do is just like excessively talk and talk and talk. I'm like, okay, let's reward that and reframe that and make that a positive aspect. Like they're social and they can get along with others, and um, putting that spin and making things a little bit more positive.
Right. Yeah, and that's part of the things I don't like about the IEPs is they focus so much on the negative instead of pulling the positive of like these are the kids' strengths. Let's use these to build the. But it's never going to be perfect. We do with what we can, and so
Right.
I think I want to talk about like with like advocating with the school and the medical team. Like, do you have that a lot since you are a clinician outside as well? How does that work with bridging with the school?
I actually, those are for me, those are two separate things, especially since one is like a medical license that I have to kind of keep separate from the coaching piece and the IEP piece. But I can be hired specifically if parents need me to go in and talk about, like if the school is fighting like a diagnosis, because I do a lot of ADHD diagnosing for in my practice. So parents will come in and say, this is what's happening, we need a diagnosis. And so I then can, go through the diagnosis process and the education, and then I can provide those documentations for the school. And then if the school pushes back and says, this is not, acceptable. So it's that kind of whole nuance of like help building the parents um, medical, like I said, documentation for the school so they can get those supports in place. But I'm hired differently to go into to talk about it because they're separate pieces. Yeah,
Right, that makes sense.
yeah,
But I'm sure, like in both sides, though, encouragement of the medical side talking with the school side, so that especially like for your patients that you see, so that the school knows what you're working on and they know what you're working on, and so or vice versa, what the school's working on, and that it can be fluid and like the same type of techniques being used, right?
yes. I speak to a lot of school counselors just so we're connected and we're using the same language and the same supports. I will ask, like, what are you doing in there, like in these situations, especially kids who now are well, they can't be diagnosed with PDA here in the United States because it's not a DSM-5, but there's more and more kids who have that profile of autism. And so that is a whole different ball game for kids who are autistic versus the autistic PDA. And so school is really like even more difficult for them in terms of like the demand avoidance and trying to equalize the behaviors. So um, that's another layer that's really been very difficult for some schools to understand.
Yeah, it's PDA is coming out more and more and more. I've had I have kids that have it, and for those that don't understand, I know it's I always say it wrong. Pervasive demand avoidance, and so somebody on my show said, persistent drive for autonomy,
Hmm.
and I'm like that because that's what it is,
Hmm.
with PDA, and I know it's challenging because our schools know nothing about it. Um, and it's challenging of like what supports can we put in place for our PDA kids because of the demand issues. Um,
Exactly. Well, and there's even healthcare providers that are not aware of PDA because, like I said, like here in the United States, it's not a medical diagnosis. And so there's not a lot of providers who are privy or educated in it. So it's based out of UK. There's a huge society over there and that's where the diagnosis is accepted. And then also in Australia. And there's two really great providers out there, Casey Ehrlich and Christy Forbes are the huge forerunners of the PDA. So if parents need some resources, those are some really great.
I just started following. A client told me about Casey Ehrlich, and I love her posts because they're so eye opening of the reality of why it's so different and how, as parents, even so, like not even looking at the school system, but as parents, how we can adjust how we're talking to our child to make it easier.
Absolutely. I here at home, I use because we were getting into that kind of fight with my child and myself with the demands or the requests, and so I actually use our Alexa and I put requests through Alexa. So I have them scheduled, and Alexa will come and say it out loud for him to do, rather than it coming from me myself. And so it takes away that layer of like, here's, mom nagging me again. We're kind of unequal in our hierarchy. And so it comes from a neutral party, and he can say, whether he chooses to do it or not, or snooze. So it's been actually really helpful in taking that layer off of requests.
Awesome.
Yeah.
Yeah, no, that's awesome. Because I don't remember if it was Casey's or somebody else's, but on Instagram I was scrolling through today, and somebody was saying of like, instead of telling your PDA child, pick up that sock from the floor, would you be able to pick up that sock from the floor? Because then it's their choice and it's not a demand put on them. And like simple language things, which even without PDA, I mean, for every child, I mean, I don't know what teenager doesn't say no, you know what I mean, to their parent. Whereas if you kind of make it a challenge or like, can you do that? Then I think kids are going to want to do it more, right?
Right. Well, you have to have that. I mean, kids are always going to say no, like you said, but also as a parent, we need to check our own triggers. Like what triggers me from then getting into like, well, you need to respect me, and like, how dare you talk back to me? And so it's like checking our own parenting style and what triggers us. Like I learned my own triggers back in COVID is my triggers was noise because we were all home. I have 3 boys. They're all neurodivergent. And I was like, what's wrong with me?
Right.
And I realized it's noise. And so I have some clients whose trigger is disrespect. I have another one whose is lying. So we've had to kind of work through our own triggers to like get into our own regulation so we stay connected and that our kids feel safe to be able to say no. And they feel like, okay, this is a safe environment. My mom's not going to freak out on me. I'm safe and we're still connected, because that's when the beauty happens.
Right, that's so important. And it's interesting you say that because the foster parent training, like the initial training, you kind of talk about parenting styles and stuff, because when our own kid, it's different. When you bring in a foster child with their trauma and their background, it's important to know our triggers because it's such a different, and we try to connect with those kids as well, whether they're in our home for 2 days or 2 weeks or a month, because they need that connection. But yeah, I mean, the connection is so important that, like, I'm trying to think of like how to word it, but do you have pointers for parents of how to help them get that connection even when they're in that, disagreement mode?
Yeah, so I've learned how to read cues. So it's really important for parents to like take a step back and I know this word is used a lot and some people call it woo-woo, but like being mindful. So being mindful and aware of what your kids' cues are. So I have a specific kid that I can tell exactly the look on his face, and he kind of starts to like, it's almost like he's watching for something, and he's almost in this like attack mode, like pre-attack mode. So we need to figure out where our kids are going and what their triggers are, what our triggers are, because you want to catch it. I have, and I'm going to back up and say, like, sensory also comes into play with all of this. So I have a sensory seeker, I have a sensory avoider. And so finding that zone where things are calm and regulated for ourselves and for them, it's this dance of trying to figure out. So I work with parents specifically on that zone of knowing what their personal zone is and regulating, and then where their kids start to go either above or beyond that zone. And so it's our job as a parent to learn how to like regulate ourselves so we can help our kid, because we can't. I mean, it's not our kid's job to regulate. It's our job as to parent. So even like a lot of parents come to me and they're like, I need help with their behaviors. Their behaviors are so out of control. That's what the parents think, but really it's actually coming from us and not the kid. It's our job to like help them and learn that together as a family.
That makes sense, because it is behaviors are reactions to their environment and what's happening at that point in time. And like gone are the days of like when we grew up, you know, at least when I grew up, I know, and my husband, it was you did what our parents said because they were our parents, period. Like, you know, like you did, like that was it. Like if you didn't, you got backhanded or, you know, something like that. But it was just, I don't know, like it never, like to defy my parents and, you know, I mean, yeah, obviously I wasn't a perfect kid. Like, you know, my mom's probably watching going, yeah, you did that, you know. but it's just like, it's so like our environment today is so different from when, you know, the parents were kids, of what's available and what's out there and what our kids need, especially, you know, after COVID with all of that just added such a different layer on top.
Mm-hmm. Well, and also, I just went to a training for like anxiety for, you know, for my practice, and it specifically was for tweens and teens and anxiety. And there was some, you know, other parents there who were like, well, I didn't have to do this. And, you know, my day when I grew up. And like you said, we're so like, this is how I was raised. I'm going to continue down that path. It worked. I turned out okay. But our world is so different than when we grew up. I mean, we have like the immediacy of like, you can order something and it'll come to our door in a couple hours. We have immediate information getting on our phones. Our kids are isolated because of just that relationship of not being as connected as we were. Like, I'm sure same for you. We were thrown out outside. Parents were like, come back at dinner time, you know, see you later.
When the street lights come on. Right?
And that doesn't happen anymore. And so you can't take how you were raised in that time frame, you know, even 10 years ago, because it's so different now. And so we have to think about it differently in a different lens.
Right. And that's the thing. It's not, yeah, like I used to say to my dad all the time that, you know, like, yeah, he screwed up when we were kids, but he did the best he could with what he knew. And that's the thing is parents, like, you know what? It's tough parenting, period. No matter what knowledge you have, you know, doctors, teachers, like every knowledge, because every kid is different. And it's just, you know, it's interesting, like how much I know for me, how much I've grown as a person becoming a parent in growing as a parent to help support my kids, to get that connection and try and bring peace to the house.
Right. Well, you, and then also like for you with your IEP meetings and working with the school system, is the schools don't see what the kids are going through at home, especially with the masking. You know, they see like, oh, your kid's been like beautiful reports. They're quiet, they're calm, they're receptive, and at home it's like they've exploded and there's like throwing things and yelling and slamming doors, and the school doesn't see that. So it's that kind of, you have to work together to see like what is working at school. Is it really working at school? What is working
Right.
at home? Is it really working at school? And trying to like put the kid in the center and saying, okay, what is it that they need? And what is the diagnosis? And we need to go from there to figure out those supports. And everybody should be on the same page of
Right.
talking about things. Yeah.
Yeah, and that's,
And
you know,
that's
I go
why
into,
you have you
yeah.
going in and helping, people like me to go in and help and be that voice.
Right, and do that connection because I've had several cases in which the school says, "Well, I don't see any of that. It's a home problem. It's a parenting problem. It's your problem." And I've on numerous occasions at IEP meetings said, "Well, this is the problem. The child is holding it all together all day, and when then they get home, they can finally be themselves. And if they weren't having to hold themselves together all day because they had supports in place, it would be much better for everyone." And the way I describe it for teachers to understand or for the whole team to understand is I say, like, think about you having a really rough day and your boss is on top of you and this and you're holding it all together because you have to do that. You can't cuss out your boss, obviously. You can't go run out, run to the beach or whatever, but you're holding it together. And when you get home, you go for a run, you have a glass of wine, you have this. Well, imagine that every single day and not having that outlet. And that's when I see the light bulbs go off for teachers of what this is reality for these
Right.
kids.
Absolutely.
So
I mean,
hard.
even the
Yeah.
smallest thing for especially kids who have sensory issues, even like a flicker of lights at schools can set them off, or
Yeah.
noises, or people in their space. And I've had schools saying, well, I don't know what the trigger was. Like they were totally fine. I didn't put a
Yeah.
demand on them. And I'm like, oh gosh, there's so many
Right.
things. Even like just like your facial expression, especially kids, with PDA, if they think that you're mad at them, or you have a look on your face, or your body language can just like set them into this like fight or flight and feeling like they need to equalize. So
Right.
there's so many different little pieces that the more support, the more education like what you're doing is just what everybody needs so we can be informed.
And learn how to be proactive. That's a big thing, like learning those triggers. And that's what, functional behavior assessments are supposed to be, like go and see like what's happening, what's triggering and what, so it's different with our autistic kids, especially with the PDA, but the functional behavior assessment can come in handy because at least it helps us with the triggers. So it might not be a replacement behavior. It might be let's replace what the triggers are and figure out to be proactive there.
Right, right.
So,
Do
and
you
so
see?
when you go in, I was just going to say with coaching, like, so you do coaching in the sense of going to IEP meetings with parents. And then do you also do like individual coaching of just teaching parents of how to connect with their kids? And like, what does that look like?
Yes, I have a few different hats. So I do the IEP, go into the IEP with parents. I also do executive function coaching for kids with ADHD who need to work on those skills. I am a medication prescriber, but I also really believe that medication's not
Yeah.
the ultimate tool. I mean, there's no way that a medication is going to teach you how to organize. So I teach the different executive function skills so people can be successful as they get older. And then the other piece is parent coaching. So working with parents on the different challenges that they see individually. So, one parent, it may be the behavioral challenges. Another parent, it may be the school, or another one may be sensory. So I actually individualize my work with the parents on their challenges that they perceive, and then we dive deeper into that connection and that regulation with the entire family.
So it's not therapy. It's definitely not
It's not
therapy.
it's not therapy.
Right.
No, no.
Even though technically you're licensed to be a therapist, but it's more, but I like it because it's more coaching. Because I know a lot of people are like, I don't need therapy. I'm like, but it's not. It's learning how to be a better parent, basically, right?
Mhm. Yes.
And learning about
There's
yourself.
tips, there's tricks, there's strategies. And then there's, like I said, that kind of that awareness so we can change. We're moving forward. Therapy typically is like diving into like the past and what has occurred in the past in healing versus like, when, like you mentioned, the trauma. So working with families and kids who, foster adoptive, that have trauma in the past and healing that. Whereas coaching is working on the present and trying to move forward with a better pathway.
Right. That is awesome. So I know you're in Seattle. We said that. Are you just in Seattle area, or do you provide coaching virtually for other areas?
I do virtually for everybody. Actually just had a client in Germany, which was a little tricky with the time change.
I've had two clients in Germany. That's so funny.
Yeah. I think because I was on a podcast that was based internationally, which was fabulous. But yes, I do. It's just anywhere that works out. And then I also can do it face-to-face here in Seattle.
That's great. And so if people want to get in touch with you on any of your hats and need help, what's the best way for them to do that?
Well, thank you. So my website is willowtreeparenting.com. I chose Willow Tree because that tree, it needs to be flexible, and it bends and it adapts, which is what us as parents need to do. We need to be flexible and adapt and bend, especially working with neurodivergent kids. And then my email is mastercoach@willowtree.com. Or
That's
I'm
great.
on Facebook.
And I know, and I just had somebody just did a comment. So somebody watching live is like thinks it's great that it's international, because it is true. Like I know for me, international is because American schools internationally have to follow the federal laws here. So which I didn't know until I knew that. But and I know I've had somebody on I'm trying to remember who, but somebody else has been on my show that does international as well, because even though it's not the same laws in the school system, as a parent, we definitely, it is international, obviously. We're all parents, it doesn't matter what country we're in. So I love that you're available to do that as well. Thank you so much. And I know we're going to put everything in the show notes of how people can contact you. This has been absolutely wonderful. Thank you so much for being on my show.
Thank you so much, Frances. And thank you for what you do for educating people. This has been really vital for people.
Thank you.
You've been listening to Stress Free IEP with your host, Frances Schefter. Remember, you do not need to do it all alone. You can reach Frances through schefterlaw.com, where prior episodes are also posted. Thank you for your positive reviews, comments, and sharing the show with others through YouTube, LinkedIn, Apple Podcasts, Spotify, Google Podcasts, Stitcher, and more.